I'm going to take a slightly different approach. I'm going to say the primary barrier to PrEP are actually healthcare providers. I'm just going to start there. And the reason I say that is because, for whatever reason, a lot of us believe that the age that you're supposed to stop having sex is whatever age your parents are, or what they were. And I say that because we have gotten into a habit of pretending that PrEP is all about your behavior, and I would contend that we increasingly now know that this is almost as important to be your geography. Where you live, where you reside is actually the better teller of whether or not you will actually acquire HIV in the United States, because half of the people that acquire every year can be identified with roughly 48 counties, 3 cities, and 7 states. That's it. And while we like to talk about who is having sex with who and how often and whatever by healthcare providers, I would contend that the bigger problem is that we are using that as not so much as an access, but as a barrier to healthcare. If you are a woman and you went to your doctor and they never did a pap smear, you would not keep going to them. You would not keep advising your friends to go to them. But why do we go? The pap smear is just literally a screen for a viral infection that's mostly related to sexually transmission, leading to cervical cancer. HIV for PrEP is a viral infection screening that looks for the same kind of process that we just don't pretend, or we pretend that everybody that we talk to, we can somehow look at and pretend who they are. And while I agree with you that there's a certain amount of this about what we see in the advertising and so forth, you will not get on pre-exposure prophylaxis unless you see someone who can write a prescription for you. Those two things go together.